The next speaker is Dr. Gomez, who is a medical oncologist here. We actually were at Sloan Kettering together for 10 years as well before he came here. And so he's part of the knockout punch for lung cancer and mesothelioma. So you got surgery, you got radiation, and you got medical oncology. So this is what I consider the best medical oncologist in the entire planet Earth. Dr. Gomez.
Thank you guys for inviting me, and thank you guys for coming on a nice, beautiful Saturday morning. So I was asked to talk a little bit about the progress towards curing the incurable. And to me, that basically is about hope. And so I'm going to show you some scientific tables and graphs, but I don't want you to focus on all of that. I want you to focus on the small things that I'll point out in those graphs that are what gives me hope. And so we'll start by looking at mesothelioma 25 years ago. And in this case, you can focus on the first row, and these are the survivals, median survival, so the point at which 50% of the patients are still alive. And the first row shows what was happening in 2000 in patients who had surgery. So epithelioid mesothelioma, 15 months, and the others about 10 months. So at 10 months, only half of the patients were still alive. And this is after extensive surgeries. The bottom row, all the way down, is the survival for patients who had neither surgery nor radiation. And so 9 months for epithelioid mesothelioma and 2 and 5 for some of the other types. So these are patients who were getting, at that time, chemotherapy. And these numbers are terrible. You know, a patient who has the most advanced treatment lives 9 months. So I'm going to show you a few things that have been able to change that. The first is a fairly simple thing. This is tumor treating fields where a patient applies some pads to the chest and has a battery which they carry around for up to 18 hours of the day, which sends a small current of electricity throughout those 18 hours. And this is a trial that was done in combination with chemotherapy. And the only thing you need to look at here is just the median survival in that first row in the table, which is 18.2 months. So there are things that have been able to improve those numbers that we see from the year 2000. The next big step in the standard treatment of mesothelioma, and I'm going to talk to you only about things that are currently happening, that we do as a standard. There are many things, as Dr. Adesumile showed, that are being developed that have the potential to be even better than what we're doing now. But I want to show you that what we're doing now is actually much better than where we were a few years ago. So this is one of the first big trials. The blue box, chemotherapy plus immunotherapy. Pembrolizumab is an immunotherapy compared to chemotherapy alone, 440 patients, which is a fairly large trial for mesothelioma. And you can see the survival curves. The red curve is for chemotherapy with immunotherapy. And I want you to focus only really here at the end, where you can see this tail of that curve of patients who have kind of plateaued, or at least the loss of patients has plateaued, and you have patients who now have a much longer survival. And those are all of the patients on the trial. On the right side, you see the patients with non-epithelioid mesothelioma, so the more aggressive and more deadly form of mesothelioma. And look at this beautiful tail at that curve. There are patients way out there years after. The 3-year overall survival is 23%. So immunotherapy has, single agent immunotherapy has improved things significantly. And so the next step was combining 2 immunotherapy drugs. This was an even bigger trial, 605 patients with 2 immunotherapy drugs, ipilimumab and nivolumab. You may have seen the commercials on TV, compared to chemotherapy. And again, these are not patients who are going to have surgery. And I'll go back to the previous study, also patients who were ineligible for surgery. So this is not operated, only chemotherapy and immunotherapy. And you can see for all of the patients, there is this tail. And this is out to 54 months. So there are patients who are alive and potentially either visibly disease-free or with controlled disease who are doing well after all that time. The bottom curve is the patients with epithelioid, the less aggressive form. You can see a very nice tail out here. But what's even more impressive is this curve. These are the patients with the non-epithelioid histology, the patients with the aggressive disease. And look at the difference between immunotherapy and chemotherapy. So chemotherapy for many years was the only thing we could do. That red curve is patients who have never received immunotherapy, are ineligible for surgery or radiation. And out at 51 months, we still have patients who are doing well. This is one of my patients. And this is actually a very recent patient. I saw this patient for the first time less than 6 months ago. This is an 83-year-old woman with biphasic mesothelioma, a terrible disease. We would not have expected her to survive more than a month or so without treatment. A month, I think, would have been very generous. She was treated with ipilimumab and nivolumab, the 2 immunotherapy regimen. So what you can see here, you've seen the pictures of the tumors, you've seen the pictures of the lung, Raja's graphs of disease growing all around the lung. This yellow stuff, that's mesothelioma. It's growing out of the chest wall. This gray stuff is fluid. So there's no lung left on the right side. It's all collapsed and it's either occupied by fluid or mesothelioma. This is about a month and a half to 2 months after her first dose of dual immunotherapy. And so she went from a wheelchair to walking into the clinic, smiling, laughing, and being a very happy person. This is what gives me hope, because this was never seen before. We had never seen this with chemotherapy. We'd seen this with surgery, but that was always temporary. Sorry. And so now I think what's most important is to incorporate all of these things into patients who can have surgery, as Dr. Adusumilli was talking about. So this is just a case of a complete response. So a patient over here on the left side, you can see the mesothelioma in this PET scan is in black. There's all of these spots, so throughout the right chest wall. This is after starting treatment, where things sometimes actually look worse because your tumor becomes very inflamed. And this is after receiving all of the immunotherapy and chemotherapy before surgery, where things appear to be completely gone. At the time of surgery, this patient had no disease left. And so I think that this is the paradigm that we need to follow. And so this really does give me hope. I hope you guys all agree. Thank you.